Hi, I'm Dr. Kelly Starrett, Human Performance Advisor for H-Wave. When we're working with patients and athletes who are in the middle of non-specific low back pain or any kind of back pain or real back trauma, there's always two prescriptions that we work on. No matter what your diagnosis is, no matter what your condition is, no matter how long you've had your pain. These are universal. The first one is seeing if we can move more no matter the circumstances. So clearly when I'm in a lot of back distress, the idea of getting on a mini trampoline or a pogo stick sounds awful. But what we want to do is say, what is the sort of bare bones minimum movement that I can engage in that really allows me to start to have all of the things my body needs? The first is non-threatening input into the brain. So one of the things we're trying to do when we have back pain is see if we can tamp down our symptoms so that we can begin to restore and signal to our brain it's safe and that our bodies aren't a threat. And that really ultimately comes down to the idea of walking. So if you're in a very acute stage of back pain, our prescription is going to be, let's get as many 30-second efforts of walking around your kitchen as possible. So if you have a big kitchen counter or an island, can you do 30-second laps around that thing? And maybe that's it. You got up once an hour and moved your body around. But ultimately, that's going to be tomorrow. We're going to go for 11 episodes of that. And then we're going to go see if we can extend that to a minute. On the top end, from our athletic perspectives, we're always shooting for trying to get somewhere between 8 and 10,000 steps. And the reason, from a sort of a health perspective, we try to up our steps to that number is that we find that 8 is really actually a manageable number of steps, and that we really benefit from getting all of the potential sort of protective mechanisms of walking. Like basically all-cause mortality drops by 50% as soon as we walk that sort of 6,000 to 8,000 range. But one of the reasons that we're trying to, again, walk is we're trying to improve circulation and restore what the body's supposed to do, which is move. Now, typically, we end up seeing that the average adult is moving about 3,000 steps a day. So there's a lot of ways where we can be signaling to the brain that movement is part of the choice today, and walking is easy to do that. We don't care, we're totally agnostic. You don't have to go out and walk it all at once, but even just 10 one-minute walks, expanding that up, a 10-minute walk 3 times a day, ultimately is going to be crucial for your restoration of your body moving through your environment. And walking should be the first order of business to restore. So even if I have to walk around and then lay on the ground to calm down, that's okay. Even if walking made my symptoms worse temporarily, I can calm them down, and that's okay. We need to get that movement in. The second thing we want to talk about is strangely connected to that walking, and that's sleep. So when we're helping people manage and sort of tug out what seems like a very complex pain problem, one of the sort of through-line narratives there is what can we control? And it turns out sleep is one of the variables we very much try to control. So a way of thinking about this is that if I sleep less than 7 hours a night, one of the things that's going to happen is that my brain is now going to be in a higher sort of state of awareness, and it's going to be a little bit more twitchy and perceptive and easily sensitized to what's going on. So we want 7 to be this kind of bright line, which means you may need to be in bed for 8 or 9 hours to get that 7 hours of sleep. Ultimately, we're trying to move everyone in this pain cohort to really protecting and trying to get 8 hours in aggregate. There might be a nap during the day, but ultimately striking out for that 8 hours of sleep, because what we know is that 8 hours we start to kind of feel better and are managing sort of stressors better, and certainly pain is a stress. Now, where this is connected is that walking actually creates sleep pressure. I accumulate enough non-exercise activity in the day where I actually feel like I want to fall asleep. And one of the problems you're seeing is that if you've got low back pain and you're managing an acute symptom or even chronic symptom of low back pain, chronic bout, is that we see highly disrupted sleep and less desire to move. And both of those things start to make it more complex as a sort of set of behaviors for me to tug out and get myself out of this kind of gnarly pain spiral or pain sort of circle. So ultimately, we're trying to max out steps. We're trying to have a bright line around trying to accumulate enough sleep and appreciating that if I get a little more sleep, I feel a little bit better, I want to move more. If I move more, I can accumulate enough non-exercise activity fatigue that I actually want to sleep. So however you're starting those, even if you're only getting 4 hours of sleep at night, we can shoot for 4 hours and 20 minutes or 4 hours and 30 minutes. We can shoot for 5 hours, even if I'm not walking very much. The idea is tomorrow I'm going to see if I can get a little bit more. Those two behaviors make up essential practices to help you manage back pain in the long term.